This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly news update coming to you from the Health Broadcasting Service HBS Radio channel. Scientists identify new gene differences in severe COVID patients. Scientists have pinpointed 16 new genetic variants in people who developed severe COVID-19 in a large study published on Monday that could help researchers develop treatments for very sick patients. The results suggest that people with severe COVID have genes that predispose them to one of two problems: failure to limit the ability of the virus to make copies of itself, or excessive inflammation and blood clotting. The scientists said their discoveries, published in the journal Nature, could help prioritize the likely treatments that could work against the disease. Eventually, the information could even help predict which patients were likely to become severely ill. It is potentially possible in future that we will be able to make predictions about patients based on their genome at the point of presenting for critical care, said Kenneth Bailey, consultant in critical care medicine at the University of Edinburgh and one of the study authors, told reporters. The genetic analysis of nearly 56,000 samples from people in Britain showed differences in 23 genes in COVID-19 patients who became critically ill, when compared with the DNA of other groups included in the study, including 16 differences that had not been previously identified. The new findings could help guide scientists in their search for existing drugs that might be useful for treating COVID-19. For example, the researchers found changes in key genes that regulate the level of factor VIII, a protein involved in forming blood clots. Blood clotting is one of the main reasons why patients with COVID develop a shortage of oxygen. So that's potentially targetable to prevent those clots from forming, Bailey said. But we can't know if these medicines will work until we try them in people. One of the previously discovered genes, TYK2, is targeted by Eli Lilly's arthritis drug baricitinib, now being studied as a treatment for COVID-19. The drug was shown last week to cut the risk of death and hospitalization in COVID-19 patients by 13% in a trial. In another development, World Health Organization confirms additional attacks on Ukraine health care. The World Health Organization has confirmed 7 attacks on healthcare infrastructure in Ukraine since the start of a Russian invasion on February 24, up from 4 the previous day, the United Nations agency said in an emailed response to Reuters on Monday. As of 7 March, 9 verified incidents of attacks on healthcare in Ukraine have been published on the surveillance system of attacks on healthcare, 7 with confirmed certainty level, and 2 with possible certainty level, a World Health Organization official said in an email, referring to its database. That was up from 4 confirmed attacks on the World Health Organization website the previous day. World Health Organization Director General Tedros Adhanom Ghebreyesus said on Twitter, on Sunday, that several attacks had occurred without giving details, adding they were a violation of international humanitarian law. The World Health Organization official gave no information on the perpetrators since its surveillance system has no mandate to collect information on them. 6 of the 7 confirmed attacks involved heavy weaponry, the database showed. 1 involved individual weapon, such as grenades or improvised explosive devices, on an ambulance on February 26. The confirmed attacks together caused 6 deaths and 12 injuries. The health facilities are protected by the international humanitarian law, but it is still happening again, Francesco Rocca, president of the International Federation of Red Cross and Red Crescent Societies, told journalists on Monday. This is very sad. Hundreds of thousands in Ukraine cut off from aid, United Nations says. Hundreds of thousands of people inside Ukraine have been cut off from life-saving aid due to the military encirclement of cities, a United Nations report said on Monday, calling urgently for safe passage. Attempts are underway to create humanitarian corridors after 2 days of failed ceasefires intended to let civilians flee. Such routes are also critical for bringing aid such as water, food and medicine. Reliable and predictable windows of silence and safe passage are urgently needed to relocate people whose lives are at risk and provide life-saving humanitarian relief supplies, said a bulletin from the Office for the Coordination of Humanitarian Affairs on Monday, based on information received through to Sunday. Russia on Monday announced new corridors leading to Russia itself and its ally Belarus, a move denounced by Kiev as an immoral stunt. Office for the Coordination of Humanitarian Affairs said UN agencies, humanitarian partners and the Ukrainian government were ramping up relief activities inside the country but could not reach some of those most in need. In Kherson, southern Ukraine, about 30 trucks stocked with aid have been unable to enter due to ongoing clashes, OCHA said. In other places, supplies of water and essential medicines were running out, including at a psychiatric hospital in Borodyanka, about 60 kilometers, 37 miles from Kiev, which has hundreds of patients with some requiring round-the-clock assistance. Oxygen reserves for COVID-19 patients and others were also running desperately low, and clashes have shut off gas supplies to hundreds of thousands of households, it said. And finally in this segment, Germany to receive patients from Ukraine, says Health Minister. Germany is preparing to receive seriously injured civilians and soldiers from Ukraine and patients who have to be transferred from Ukrainian hospitals that have been bombed, German Health Minister Karl Lauterbach said on Monday. Germany has a very strong healthcare system. We showed that during the crisis. We must now use this strength again, Lauterbach said in a news conference. Feel free to connect with us on our Facebook platform, at Health Broadcast, and our website at www.healthbroadcastingservice.com. And please remember to press the subscribe button to stay abreast of timely, vital and authentic health news developments from around the world, delivered to you by the Health Broadcasting Service on YouTube channel. We will bring you more updates as news develop. Stay safe, remain healthy. And bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.